There are basically many feeding problems in infants, but I would love to talk about five major feeding problems you are likely to encounter when you are taking care of your infants. Now, if you are a lactating mother or a caregiver, these are major problems you're likely to see, major feeding problems you're likely to encounter when you have an infant around you, when you're taking care of an infant. The first is regurgitation. This regurgitation has to do with when your baby tends to bring out some smaller pieces of food, usually after feeding, few minutes after, it could be few minutes after feeding, it could be an hour after feeding. It can actually be as a result of infrequent stability or constant movements immediately after feeding. This is usually seen when your baby doesn't stay one place, probably after each feed. The best way to reduce regurgitation is just by gently rubbing the back of the baby. When you rub the back, the food is likely to go back. And one sign you receive is when your baby bumps. Yes, when your baby bumps. When your baby bumps, that is one of the signs it will give you that your baby is not likely to regurgitate anymore, at least for that period. Then the second one is vomiting. Yes, vomiting is the second feeding problem you're likely to encounter if you're taking care of an infant, specifically during lactation. This vomiting occurs due to infrequent feeding or overfeeding. When you when you when you feed your baby excessively, or when you give your baby frequently, or when you overfeed your baby is likely to vomit. One way to reduce the occurrence of vomiting is to check the amount of food you give your baby, and at a point, the frequency too. Then the third one is diarrhea. Yes, diarrhea is very evident in most infants because of contaminated objects around them or contaminated environments. Yes, when one or two of any objects that they come in contact is contaminated by bacteria, they are likely to experience diarrhea. And this diarrhea is usually seen when they're passing out watery stools. One way to treat and manage diarrhea is, apart from administering first aid treatment, which is your ORS, oral rehydration solution, you can as well make sure you take the infant to see a doctor. That will do a lot, because most children who are not well taken care of during diarrhea are likely to experience dehydration, and I believe you wouldn't want that. The fourth one is colic. Yes, colic is an extreme abdominal cramp experienced usually from 1 month, 2 months, and 3 months. That's first 3 months of life, and it can actually occur due to so many reasons. And one way to treat, there are different ways one can actually control colic. There are different ways one can control colic, and that's why it is very, very important that you see your doctor. You communicate with your doctor to know the particular way you can manage colic depending on the symptoms you exhibit. Depending on the symptom exhibited, colic can actually be managed. Generally, colic can be caused due to swallowing of excessive air during feeding. During feeding section, the baby tends to swallow so much air, or and all that. So one way to help manage colic is trying to reduce the amount of air or gas the baby takes in during feeding, and also taking your taking recommendations from your health worker, from your health provider, from a pediatrician. Yes. So the last but not the least is constipation. Yes, constipation is one of the feeding problem you're likely to see if your child is an infant. Constipation is when your infant tends to pass out hard stool, hard stools. Yes, it can actually be managed by making sure that your baby take adequate amount of fiber-rich foods, maybe through breastfeeding as a mother. You can also manage constipation through seeing your health provider and your pediatrician per se. And you can actually help your baby by administering enough of fluid diets. That is the breast milk or the formula feed. Sometimes constipation can occur when inadequate amount of formula feed is given to a baby, or doing mixed feeding. Mixed feeding is not properly done well. It can actually result to constipation. So please, if you have any other suggestions, please, I would like to see that in my comment section. Thank you.